pituitary gland, anything to do with growth and development, of course. I mean, we know this. The adrenals have a very intimate connection with the pituitary. The pituitary pineal and adrenal relationship. Whenever you have a lot of pituitary imbalances, growth and development imbalances, make sure that you at least look at the adrenals as well. Remember, adrenals are trying to keep things, they're trying to keep you going. I mean, we know about adrenaline and a fight or flight response, but anytime you need a burst of activity, your adrenals are being called in. And like I was just saying, for a lot of people today, it's putting out one fire after another. So you're getting these continual bursts of adrenal activity. And that does have an effect on the pituitary and the release of hormones. There are some hormones that are only released when you're in a more parasympathetic state. Again, growing and developing is really much more of a parasympathetic activity. A lot of it happens at night. If you're continually in sympathetic mode and sympathetic arousal, it's much harder to regulate hormonal systems, regulate pituitary activities. And that relationship is always important to keep in mind, and sometimes we don't always think about it, but the adrenals along with the pituitaries. The pituitary, remember where it lives. It lives in the sella turcica. So, I don't know if, does your lid come off? Perhaps. Yes, okay. This is new, isn't it pretty? Yeah. So, thinking back on the sella turcica, this little pocket that is right in the body of the sphenoid, acts like a little cup. And the pituitary lives right in there. Right above that is the optic chiasm. So we have an eye on each side, we have the optic nerves coming back, and they cross at the optic chiasm, which is located right over the pituitary. So these are midline structures. They're close to the center of things, subcortically. And sometimes what you'll actually see, because one's above the other, is a shearing of the optic chiasm and the pituitary with its little stalk there. A typical pattern is for the pituitary to shift to the right and the optic chiasm to shift to the left. But depending on trauma or what kind of input you have, I mean, it doesn't have to be that way. But oftentimes the pituitary is off to the right and optic chiasm is off to the left. And so what that's going to do, if we think about the pituitary sitting here with its little stalk, and that's how it gets its blood supply. Remember the tentorium. Tentorium cerebellum is also coming from the sphenoid, attaching to the petrous portions of the temporal bone, and around posteriorly on the inside of the occiput. That tentorium is right in between the pituitary and its stalk. If that tentorium is shifted, either because of trauma, it can be birth trauma, autistic spectrum issues, we know that there's always a lot of tension across the tentorium, that can act to kind of strangulate the vasculature that is coming into the pituitary. So with a very tight tentorium, we have to think about issues with the pituitary too. And if it's not getting enough blood supply to function well, and remember, hormones are released into the bloodstream and have an effect at a target gland that's somewhere distal. If they literally can't get out to get to their target, then you're again going to have the issues with growth and development. So it can be the pituitary, it can also be the neighborhood, the tentorium or its relationship with the optic chiasm, as all these things are kind of stacked up right in this central area. There is, on page 124, we do have some compression syndrome, so there's a compression syndrome for the pituitary gland to help open that up. There's a compression syndrome for the optic chiasm to help get more mobility there. There's type 1s for the optic chiasm to get more mobility of those structures. And then we have some techniques and type 1s for the pituitary, an energetic phenomenon for the pituitary itself. But the idea is just to try to get more motion through this whole area. And I would just add as an aside here that even just doing a little bit of a tentorium release with the lateral vault hold on either side and just going indirect is going to affect that tissue right across here to take some of the stress off the pituitary.